Okay. Good morning, Dr. Allison. How are you doing?
Hi, good. Thanks for having me.
Thanks for coming on today. I am really honored to have you here today. We had a little bit of a delay because we are in finals week. There's a
Yeah.
lot going on. But I want to say thank you for making our time to come on the show today. I appreciate you doing this, and it's gonna be fun and insightful.
Good.
Um, you are the founder, and also you're the founder of Primary Healthcare, right, in Kansas City?
Yeah, Kansas City Direct Primary Care. Here, I've got some like swag right here. This is our gig. Look at
Eh,
that nice little logo action.
okay, so give us a little bit background, like a bio about yourself and how you got into starting your own direct primary care.
Yeah. So I am a board certified family practice physician, trained like any other doctor, anybody, if you imagine a doctor, like that was my training.
Yeah.
But towards the end of my training, I realized that the way that the U.S. healthcare system provides primary care doesn't make a lot of sense. It doesn't lead to good outcomes. We
Hmm.
spend a lot of money on it.
Right.
Most people don't enjoy the doctor's office, not just because the connotation with illness, but also that like it just sucks. Like you're
Mm.
waiting and it's hard to communicate and calling the doctor back and you can never get help when you need help. Everything about it. I was like, man, I'm going to enter this industry that everybody kind of hates. And
Yeah.
that's really hard to do that as a career. And so at that point I said, screw it. I'm going to start my own practice. We're going to do it the right way. We're going to treat people like people. We're going to be able to say yes to people. We're going to be able to help people. We're going to communicate in a timely manner. We're going to have customer service at the forefront. Like all of these things that you don't associate with healthcare. I was
Yes.
like, we can do it. And the main way that we execute on that is that we've actually changed the economic model.
Okay.
So the reason healthcare sucks so much is because doctors are paid per thing that they do. And so they're not paid to call you back. They're not paid to get on the phone with you,
Mm.
and things like that. And so, and not only that, but the person paying the doctor is not you, it's the insurance company. So the
Mm.
doctors are doing whatever the insurance companies want them to do, not what you want them to do.
Yes. Okay.
So we got rid of it. So we got rid of insurance. We don't take any insurance. We don't bill any insurance here. And we also got rid of that like fee for service, sort of we charge per thing that we do. We got rid of that and we just did a flat monthly fee for everybody. So we bill our patients $65 a month, flat monthly fee. They can get all the primary care they want or as little as they want. They can interact with us every day if they feel like it. At
Mm.
that point, we refer them to their mental health provider because that's probably more of what's going on.
Yeah.
But anyway, I joke. Uh, but it's made it's changed my life, changed my career, made me like medicine. Mhm.
Now with this virtual world that we have in, do you think this has helped the health department, or do you think it's making it lag behind with what you do?
Um, what's interesting is that times of chaos breed innovation. So it's actually a really cool time to be an entrepreneur.
Mm.
It's a lot harder to be a legacy institution. So it's a lot harder to be like, in the Kansas City metro area, you think of like St. Luke's, or you think of KU, or you think of Research or Truman, like these big institutions.
Yes.
They're like they're like a freaking, train, and they have a ton
Mm.
of inertia. And to get that train to turn is immensely difficult.
Mm.
Um,
Mm.
and you're seeing that because, I mean, not to get too far off topic, but large hospitals are seeing their revenues
Yeah.
decimated
Yeah.
because they operate off of their fee structure is, if as bodies go through the door, they charge and
Mm.
they bill and they do big expensive procedures. And so hospitals essentially didn't do that for 6 weeks.
Mm.
And so they're
Mm.
seeing millions to, close to $1 billion in lost revenue, which means ironically in these large systems, nurses are getting laid off, doctors are being furloughed, doctors are being
Yes.
asked to take unpaid time off. And so it's this really interesting paradox that we're in, that the way that we funded healthcare in a
Mhm.
capitalist model, rewarding more throughput and growth, it doesn't work when you have a public health emergency. You need to
Mm.
be able to adapt and switch. Now, I'm not saying that the entrepreneurs watching this podcast should create an entire business model based on pandemics, because theoretically we could get through pandemics and we'll move on. But the happy medium in healthcare would be, how do you create a business model that works in a pandemic and that works, when things are normal, if you will.
Mm. Now, I wanna ask you this. being a healthcare professional, what are some, some conspiracy theories out there that you think, or some misinformation that people are getting, you've seen in the media that you think you want to clarify for us today and be like, this is not right. You should not do that.
Great question. So what, I mean, I can list off a whole bunch of stuff, but ultimately the truth is that you, everybody listening, everybody needs to have a professional or an expert that they can rely on for good information. And so please, find a primary care doctor that you know and trust. You guys are welcome to look at our website. We do updates frequently on COVID, but find somebody that you actually trust, who is not Twitter, who's not Facebook, not TikTok, not YouTube, somebody that has like good, a primary source of information, or potentially a secondary source. Explicitly, you already touched on, don't drink bleach, don't inject disinfectants, don't inject anything unless you have, diabetes, or you're injecting blood thinners or a pharmaceutical. The idea of please just don't inject anything. Read labels. Poisons are poisons. They've always been poisons. That's the reason we lock them away from kids, because they're dangerous. Other things, masks are super important. I'm not wearing one because I'm in my office space. I'm, more than 6 feet away from people. I'm not interacting with others, but masks are important to protect other people. You have to have that like in your head. It's not necessarily that you're going to decrease the risk of contracting a virus yourself, but rather if you sneeze, if you talk. I sometimes get super excited and I spit when I talk. We all do this, right? Yeah. And so it's that
like,
sort of,
my bad.
Yeah, exactly. And then all of a sudden, you spit on somebody, you're like, I can't take that back. So that's what it's for. It's to protect other people. And you're not going to get, I think I saw like carbon dioxide poisoning or something. People are worried about, like, that's not going to happen. They're not that, no, that's not a thing. What else has been out there?
What about chloroquine? What about chloroquine?
Hydroxychloroquine.
Yes.
So those are still being studied. Good science takes time. Yes. And so if you want quick answers, then you're going to get bad answers when it comes to science. And so what the jury's still out on that. It's promising. The initial studies have, that's why we're studying it, is because, people said, hey, I tried this and I think it actually helped. And so you take that sort of personal experience of what we call an anecdote or a story or a case study, and you say, wow, it worked for this one person. You apply it to many people. In the concept of a randomized control trial, you essentially have a population of people with an illness. Half of them get a placebo, something inert, doesn't really have any effect.
Yeah.
Half of them get the drug. And then at the end, you compare, how did those two groups do? And that takes time, right? You can't do that overnight. People literally have to die or survive in order for us to know if it works. And so we're not at the point where with any sort of certainty you can say it's a good medicine or not. And politicians who do so are irresponsible.
Now let me ask you this: with Kansas City opening up and everything, what do you think is going to happen when this is open? Like in a few weeks, when everybody's open, what do you anticipate that what could happen?
So, like I said, the virus is out there and it doesn't listen to stay-at-home orders.
Yeah.
And so as we start to intermingle more and as we start to interact more, the propensity or the ability for that virus to spread person to person goes way up, and the more physical interactions. We know that this virus infects on average, if we don't do any distancing, if we have a normal interactions, we know the virus infects about, if one person has it, they infect 2 people. And so each of those people infect 2 people, right? So that's where you get exponential growth. And so if you go back to normal social interactions, you're going to go back to seeing the virus spreading exponentially.
Yeah. So what do you think about vaccines? Do you think, let me ask you this way. Do you think our bodies can get used to this virus, that it can actually kill it by itself? And what do you think about vaccines coming in general?
Sure. So I like the way that you asked that. So our bodies are beautifully designed to fight off infections. That's why we have an immune system.
Yes.
I took an entire month-long course in immunology in medical school, and let me tell you what, it was a really complicated course. So going back to that whole expert thing, there are people that dedicate entire research careers to the immune system. So this is not an easy subject. But to your point, I think you said like, can the body get used to the virus? Is kind of
Yeah.
the way you phrase
Be
it.
able to attack it and kill it.
Yes. So it's not necessarily that the body gets used to the virus, but rather, if you think of your immune system as sort of like an army, and your army is suited up in gear, in a uniform, so that the body can see like, all right, those are my men, here's our uniform. The virus is essentially an outside invader that's wearing a completely different uniform. So our army of our immune system sees it and attacks it. Now, like any warfare, there's a lot of collateral damage when you're attacking this outside invader. You have, gunfire, you have bombs, you have all these things. And so inside of your body, it's the same thing. This is why you get a fever. This is your body actively trying to hurt that virus, that invader. There's more than just fever, though. There's what we call cytokines that are essentially messengers that tell different parts of the immune system's army, like this is where the infection is, this is what we need to do to fight it, and all these little things. And so that response of your body, the army that you have within you to fight off invaders, fighting the invader, that response can actually lead to a lot of harmful things because your body's working so hard to attack the invader. This is where you hear about like sepsis and things like that. That's where that comes from. Now, the end result is that once this is fought off and once this is gone, the army that you have essentially creates what we call antibodies, so that the next time this guy even shows up anywhere near your body, there's a quick response system. It's essentially like a surveillance. Like your body's waiting for this person, this invader, to come back and immediately attacks it, so you don't have that whole immune response again. You basically attack it, clear it out, move on. So that's how antibodies work.
Okay.
And so your body is designed to create antibodies, and any healthy immune system, that's the point of it. Immunizations essentially create just a small little threat. So if this is our like invader in like the real world, if we just get sick, a vaccine is like a tiny little guy that like is injected into the body. Your army of your immune system notices it, attacks it super quick. This little bit of the illness doesn't have any capability to cause that huge warfare that I talked about. Your body identifies it, puts it on surveillance, creates an antibody, so the next time you're exposed to it, the army of your immune system comes in real quick, identifies it, moves it out. So immunizations are incredibly brilliant. They are so wonderful. They do so much to prevent illness and harm, and that whole warfare within the body of the immune system, sepsis, all that stuff. They're great.
Speaking of immunization, the reason why I asked you this is because, again, there is a lot of conspiracy theories on the internet of how the negative impact of having immunization on people, where there are certain metals or something that are in those immunization capsules or injections that can harm the body. That's why people are saying, I'm not going to take it because of that. So that's kind of like my concern about when it comes to immunization and the impacts of it.
Yeah. And I think that most people that are scared of that are coming from a good place, right? They're scared. They're scared that essentially the immunization is going to be more harmful than the disease. But I think as we're experiencing right now, this is what a world without vaccines looks like. We have vaccines for this scary stuff that has caused pandemics in the past. Like we have vaccines for polio. Polio left people paralyzed and in iron lungs. You don't even see that anymore. And so while it's okay to be scared, the diseases that you're preventing with vaccines are far scarier than the vaccines themselves.
Wow, that's awesome. Now, moving on to personal questions to you. So with your company, what is the goal is trying to achieve in Kansas City with your direct remote healthcare? What is the goal and how affordable is it for people to be able to access it?
Our goal is to provide transparently priced, accessible healthcare for everybody. And so we are $65 a month for most people. And if you compare that to other things that are going to, cost around that same amount, getting healthcare, access to a doctor, your personal doctor that you have a relationship with, that you can ask any questions of, for $65 a month, that's the same as or cheaper than like a phone bill, cable bill. If you add up all your Hulu, Netflix, like it's an incredibly valuable service at a low cost. So we believe that it's high value. Now we also know that not everybody can afford that, and that's the way the world is. But in the United States, we've decided healthcare is a commodity, and we're going to sell it, and you can access it if you can afford it. That's just how healthcare is in the United States. And so our goal is to try and make it really transparent as to how much we're charging.
That's awesome. What is the capacity of employees at your company? How many people do you have?
Oh, we're tiny. We have 1.5 full-time employees and then 2 physicians.
Okay. Oh, awesome. Now, I think we're almost at the end of the show. Let me ask you this. What do you want to do when this is all over?
You mean when I sell my business and retire to a yacht in the Bahamas drinking martinis, or when COVID is over?
That's a little bit too in the future. Let's hope and believe that this pandemic will stop in 2 months.
Okay, fine.
After 2 months when it's over.
You're too optimistic. That's okay. You know, I think that what's cool about what we do is that I don't have any, I mean, we're just gonna keep doing what we do, which is providing transparently priced, affordable, you know, adaptable healthcare for people who desire a better healthcare experience. Insured or uninsured, you know, we don't discriminate. We take care of everybody, from gig workers and those who make less than $16,000 a year, all the way to those who make way more money than I'm ever going to see in a lifetime, who just value the high touch primary care that we offer. So we don't have a lot of changes, which is kind of nice.
So you're not gonna go on any vacation or cruise or going out running, doing sports when it's all over. You're just gonna keep working. Is that what you're gonna be doing after this?
You're talking to a doc. All I know how to do is work. I can't not work.
Okay.
But no, it's very pathological. Actually, my husband and I are going to go camping for a week. We're going to go off the grid and just, you know, pitch a tent and kind of do some hiking and not shower, and not talk to people, for a week here at the end of May, down in southern Colorado, northern New Mexico. So don't come looking for me. I will be off the grid.
Yeah.
I figured it's like the safest vacation. I'm certainly not going to get on a cruise anytime.
Yeah. Okay, so what do you want to say to people out there? What do you want to say to entrepreneurs or just people out there to say, keep going, don't quit. You know, this is a hard time, but we're going to get through this.
Well, yeah, I think you said it pretty well right there. I think one of the biggest things about entrepreneurship is that when entrepreneurs or potential entrepreneurs are sitting there and calculating the risk of, you know, do I make the leap? Do I start my business? Do I follow this idea? So many entrepreneurs are held hostage in their jobs because of the health insurance benefit. And if you're still in college, I'm going to make an assumption that you're under 26 and potentially still on your parents' insurance. So potentially you haven't thought about this, and perhaps that's true of your audience as well. But there is a certain point when you start to make job decisions based on whether or not you get access to health insurance. And I find that to be incredibly stifling to entrepreneurship and actually stifling innovation in the United States. I am constantly crusading to try and get health insurance peeled away from employment status, because employers use it as a form of hostage. Like, you can't leave your job because they're providing your health insurance. And health insurance, if you're paying for it by yourself, can cost upwards of, you know, for myself and my husband, 2 relatively healthy people in their 30s, it's about $12,000 a year.
Wow.
It's insane.
Wow.
So for the entrepreneurs who are out there who are saying, can I make the leap? Just to say out loud that there are some ways to hack together access to healthcare. There's nothing that's great. The whole health insurance industry sucks. It is terrible. They're expensive, and what you get for it is not what you think you're going to get for it. So there's no good health insurance, but there are ways to sort of mitigate your financial risk that don't necessarily include traditional health insurance as you take the leap. So it's a real concern. People are always scared about it when they're thinking about entrepreneurship, about how to access healthcare. And so check out our website. We have some tips for small business owners and entrepreneurs to sort of how to access healthcare.
Awesome. Now, thank you. I just want to say thank you for coming on the show today. This
Sure.
is awesome, insightful. I appreciate what you're doing. You know, keep working, keep pushing, keep making it happen. And if people want to connect with you, how can they connect with you? What is your platforms or?
Yeah. So we're on Facebook. So you can actually, if you're watching on Facebook, you can find us at Kansas City Direct Primary Care. On Twitter, I believe we're at Kansas City DPC. I think that's our Instagram handle as well.
Okay.
We're on LinkedIn too, if you want to connect there, Kansas City Direct Primary Care. And follow us on all of those different avenues, because we'll post stuff regarding right now COVID, a ton of it,
Okay.
But also other stuff like Dr. Short, my partner, just wrote a blog about, type 2 diabetes. It's still out there. It's still important,
Yes.
and so we have a lot of health related information along with more up to date, what's happening in the world of COVID stuff.
Sweet, sweet, awesome. Well, thank you. I hope you stay safe, stay
Yeah.
healthy, and keep working, and we'll see you on the other side in 2 months.
You too.
About 20
Wash your
years.
hands.
Yes,
Wash your hands.
I will wash my hands. Awesome. All right.
All right.
Thank you and have a
Thank
great day.
you. See ya.